Hello and welcome. I'm Saad Dino, pharmacist and co-owner of Acton Pharmacy and West Concord Pharmacy. I would like to welcome everyone back to our show, A Healthier You. Our goal is to discuss relevant health topics and provide information to you, our viewers, that will guide you to a healthier lifestyle. Today's topic is skincare. I am pleased to welcome Dr. Alberta, a dermatologist from Emerson Hospital. With the summer in full swing, Dr. Alberta is here to offer advice on how to enjoy the beautiful weather, but still be health conscious about the sunshine. Skincare has emerged as an important health concern over the last decade. Americans spend on average $1.3 billion annually on skin protection. While the interest in skincare continues to grow, so does confusion about skin products, diseases, and treatments. Over 2 million Americans are diagnosed with skin cancer every year. With such alarming numbers, it is important to understand how to recognize symptoms of skin cancer and how to prevent it. Dr. Alberta, thank you so much for being with us today. Can you please tell us a little about yourself?
Thank you, Saad. Thank you for having me.
Our pleasure.
So my name is Lauren Alberta Wazolik. I am a dermatologist at Dermatology Associates of Concord. We're right around the corner from Emerson Hospital. And I practice general dermatology, so I see adults as well as children.
Excellent, excellent. How long have you been in practice?
I've been practicing for 5 years, but I've joined the practice here just over a year ago.
Well, welcome to the practice and
Thank
welcome again on the show. In your practice, what are some of the most common skin problems that you see?
So, of course, I see all skin conditions, but I see mostly skin cancer, basal cell skin cancer, squamous cell skin cancer. Those are the most common. Less commonly, melanoma. Okay. Of course, precancers called actinic keratoses. I perform a lot of skin checks, and in doing so, look for those things as well as monitor moles. But other very common skin conditions that I do are acne, rosacea, seborrheic dermatitis, warts, molluscum, eczema, psoriasis, really anything.
Anything.
Yeah.
Got it. Perfect. So many people are unaware of what number SPF to use when they go into a pool or a beach or be out in the sun. That's the sun protection factor. To get in their sunscreen, is there a difference between SPF 15 or SPF 30 or SPF 45? And is it necessary to go higher?
Mm-hmm. So that's a question that I get very commonly. The most important thing that you want to look for is, number one, you want to make sure that a sunscreen says that it's broad spectrum. Okay. And that means that it covers both UVA and UVB. Okay. Because both UVA and UVB, we know, are carcinogenic. They can cause skin cancer. Okay. Okay. UVA otherwise can cause premature aging of the skin, and UVB is the main cause of sunburn. So when we're looking at SPF, that's called the sun protection factor, that only refers to UVB.
Oh, okay.
Coverage of UVB. So when we look at SPF 15, SPF 30, what I tell my patients is that SPF 15, we know, actually blocks about 93% of UVB rays.
What was that number again?
93%,
okay.
SPF 15. Okay. And SPF 30 blocks about 97%, and then SPF 50 blocks about 98%. Okay. So, it is true that the higher SPF numbers block more and more UVB, but that difference is less and less the higher you go. So there's not that much of a difference between SPF 30 and an SPF of 50. Okay. But what's the most important thing is that people apply it correctly, because in fact most people don't apply it correctly, and if you don't apply it correctly, then most people actually get about a third to a half of that stated SPF value because they're not applying enough sunscreen.
Okay. So what do you mean by applying it correctly? Can you?
Right. So the way you want to apply correctly. So in general, my recommendation is look for a broad spectrum, water resistant sunscreen with an SPF of at least 30 or better.
Okay.
But to apply it correctly means you want to apply about a shot glass full, which is 1 ounce over all exposed areas of the body. You want to apply it about 15 minutes before you go outside, and then keep reapplying it every 2 hours. Especially after swimming or after sweating excessively. Don't forget your lips. You want to apply an SPF of at least 30 or better, also to your lips.
Like a lip balm, or you can
like
use the same.
Balm, like a lip balm. Yep. So that's really the most important thing. You apply enough, and you apply it. Apply it correctly and reapply it.
Now, does it matter to you whether it's cream or spray? You know, they have these sprays now, where before it used to be a lot of cream or lotions.
Right.
Does it matter?
It's really patient preference. You know, some people prefer creams, especially for the face or if you have dry skin. Some parents prefer sprays because they're really easy. You know, there is some concern about sprays. My recommendation is that if you're going to use a spray, spray it in your hands first because you don't want to inhale the fumes.
Great recommendation.
Yeah. You want to spray it in your hands first and then apply it all over to the areas exposed. But then to make sure that, again, you're applying enough, I would recommend to reapply it again immediately. So spray it in your hands, apply it all over, and then reapply it again. And then, of course, just be careful to reapply it every couple hours.
Now, so people sometimes are under the impression that, you know, all I have to do is put sunblock and I'm done. I don't have to worry about any other issues with sun. What others? But obviously that's not the case. What other recommendations do you have for patients of yours that you know, ask you about how could I protect myself besides sunblock?
Absolutely. So sunscreen is really secondary. You know, number one, you want to try to avoid the sun. You know, that's number one. But obviously, everyone goes outside. But just keep in mind that the sun's rays are strongest between the hours of 10 a.m. and 2 p.m. So seek the shade if it's available. Otherwise, sun protective clothing, so wide-brimmed hats, sunglasses, and sun protective clothing like those swimming shirts. I love those. And if appropriate, if you can wear long sleeve shirts and pants, if appropriate. Regarding clothing as well, a more tightly woven fabric and darker colored clothing, those tend to offer more protection than lighter clothes. And if you can see through the fabric, it's going to offer less protection. And then my other recommendation is to just be careful, especially around water and sand, and also snow, because don't forget that UV rays can reflect off those surfaces and can come up from below.
So the only thing, how about hats?
So absolutely, wide brim hats, sunglasses, sun protective clothing, shade. Those are all very important.
And the most important time, again, I just want to make sure I repeat to our viewers, is between the hours of 10 and 2.
Absolutely, yeah.
Thank you so much. I'm sure you get questions about tanning beds. What's the thought on that? Is it good for your skin? Is it bad for your skin? What's the bit difference between tanning in a tanning booth versus being out in the sun? So on and so forth. If you could just hit on that, that would be appreciated.
Absolutely. So, you know, we know that all ultraviolet radiation is dangerous and is carcinogenic, and that's ultraviolet rays from the sun, but also artificial light sources like tanning beds. You know, tanning beds are bad. They're bad. You know, they do emit UVA and UVB similar to the sun, but in many cases, those UV rays may be even stronger than what you're getting from the sun. The problem with tanning beds is that it's so unpredictable, the amount of UVA or UVB that you're getting. It really is very dependable on the age of the bulbs and the types of bulbs used. So that can be really dangerous. You know, tanning beds are designed to emit very high levels of UV rays in a very short amount of time, and that can be dangerous. You know, there was a recent study done that showed that frequent tanners with new high pressure bulbs can actually get up to 12 times higher UVA doses than what they would get from natural sunlight. So, you know, tanning beds can obviously emit much higher doses of, you know, UVA and UVB than what you would normally get.
12 times higher.
12 times higher.
Wow.
Up to that much. So,
Okay.
you know, we know that UV radiation from sun, but also indoor tanning devices are carcinogenic, you know, which leads to melanoma, basal cell skin cancer, and squamous cell cancer. So, you know, they're very dangerous.
So the question to you as a dermatologist, Dr. Alberta, is there a safe way to tan?
So there is no safe way to tan. You know, tanning really is DNA damage. You know, it's the direct result of UV radiation causing DNA damage. So there is no safe way to tan.
There is no safe way to tan.
No. Really, you know, spray tans and tanning creams are generally considered safe, but there is no safe way to tan.
Okay. I just want to make sure that our viewers hear that, you know, I mean, if they are going to tan, make sure you put that sunblock on and repeat every 2 hours.
You know, yeah.
So I just want to make sure that our viewers listen to that, because, you know I do once in a while. If we go out to the beach, you know, you start playing volleyball and you forget that, you know, you've applied the SPF cream or spray 2 hours ago, and you got to make sure that we do it, especially for our little ones.
Absolutely, yeah.
So,
yeah.
you know, thank you.
I mean, everyone wants to enjoy the outdoors.
Of
You know,
course.
I have little kids too, and we all enjoy the outdoors, but it's just being careful, being very careful.
Absolutely, everything in moderation.
Absolutely.
What type of treatments or recommendations do you advise your patients on if they want to keep their skin looking young? So now we're changing a little the topic to
right,
skincare.
anti-aging,
Yep.
So again, remember what I said, that it's UVA rays that leads to premature aging of the skin. So wrinkles, age spots, it's again UV radiation, particularly UVA. So stay out of the sun again. Stay out of the sun, stay out of indoor tanning devices. Obviously wear your broad spectrum sunscreen with an SPF of 30 or higher on a daily base. One other point I wanted to mention is don't forget the backs of your hands either, because you know, UVA can penetrate actually window glass. So even when you're driving, if you want to keep the backs of your hands looking young too.
Okay, perfect. That's a great recommendation. People forget about that.
Yep. But then otherwise, moisturizing regularly, using a regular moisturizer, that can actually hydrate the skin, which can reduce the appearance of fine lines and you know, really just keep the complexion brighter and more youthful. At-home treatments that are recommended are topical retinoids, so like either prescription Retin-A or an over-the-counter retinol. Those are both vitamin A derivatives, which can basically help the skin turn over, stimulate collagen, reduce fine lines, and it can even fade pigmentation on the skin. Other treatments to keep the skin younger, alpha hydroxy acids like glycolic acid, which also help stimulate collagen and fade pigmentation, but also antioxidants are another hot topic. Things like vitamin C, that's very important. Antioxidants basically help reverse previous sun damage.
Like a CoQ10, and a lot of products have CoQ10 in them now.
That's another hot antioxidant,
But as a recommendation from a physician to the audience, or from a pharmacist and a physician to the audience, is whatever you use, always check with your either pharmacist or your physician.
Absolutely.
Because some of the products may not go. You may have a condition, skin condition, that certain products should not be used.
And first and foremost, sunscreen and sun avoidance.
Excellent. What's the most? We head on skin cancer. And we know that's on the rise. What's the most types of skin cancer do you see in your specific practice, as an example?
Yeah, so the three most common skin cancers are 1 and 2, basal cell carcinoma and squamous cell carcinoma. Those are the top two, and then the third most common is melanoma. So basal cell and squamous cell, we collectively refer to those as non-melanoma skin cancers. They're, you know, by and large the most common. and a scary statistic is actually 1 in 5 Americans will develop skin cancer at some point in their lifetime. 1 in 5.
Wow.
So
Okay.
it's huge, and it's on the rise. Every year in the U.S. alone, 3.5 million non-melanoma skin cancers have been found in 2 million people. So 3.5 million skin cancers in 2 million people every year in the U.S. So it's a
double.
huge, yeah. Yeah.
Wow. Okay.
But anyway, basal cell and squamous cell are by far the most common.
Okay.
We typically see them on sun-exposed areas of the body, so places like the face, the scalp, the ears, the neck, the arms, the backs of the hands.
Okay.
You know, by and large, they're not generally life-threatening. You know, rarely they can metastasize, but for the most part, they are completely curable, usually with surgery or sometimes a cream or a scraping procedure.
Okay.
You know, so those are the most common.
So that you know, we hit that on the cancer and the treatment.
Yep.
What can someone do to prevent somebody that, you know, fair skin or dark skin or whomever the person may be? What can they do to prevent? You know, we spoke about sunblock and other you know, other preventative measures. But what can they do on an annual basis to prevent, you know, to be proactive and prevent whatever the type of condition they may have,
Right.
specifically cancer?
Yep.
You know, get caught early.
Yep.
To
Yep.
treat it and prevent it and so on and so forth. What
Absolutely.
do you recommend?
So as you said, you know, number one, sunscreen, you
Okay.
know, because skin cancer is completely preventable.
Okay.
It is completely preventable. You know, so just stay out of the sun, wear your sunscreen. But, you know, be proactive, you know, take a good look at your skin and look out for anything new, not healing, bleeding, itching, changing, growing. You know, usually, let me just tell you what they look like.
Sure.
So, you know, basal cell skin cancer tends to look like a little pimple. It's usually like a little shiny pink bump.
Okay.
They tend to bleed easily, and again, look for anything new, not healing, especially on the sun-exposed areas of the body.
Okay.
Squamous cell skin cancers tend to look a little bit of a duller pink color, a little bit scaly, again on sun-exposed areas of the body.
Okay.
We haven't really touched on melanoma yet, so melanoma is the third most common skin cancer, and it's the deadliest form of skin cancer.
Okay.
And melanoma rates are on the rise, but you know, look out for anything. We call them the ABCDEs for melanoma.
Okay. Can you describe that a little bit?
Yes. So,
Please.
so A is asymmetry, you know, and one side doesn't look like the other.
Okay.
B is a regular border, irregular border, so, you know, a notched or jagged border.
Okay.
C is color, so, you know, multiple colors or something much darker, you know, especially blues and blacks. I like to tell my patients, look out for the ugly duckling, something that just doesn't look like anything else on your skin.
Okay.
D
Good
is
recommendation.
D is diameter, which is bigger than a pencil eraser. Now, you know, that one a lot of dermatologists want to throw out because, you know, melanoma does not have to be bigger than a pencil eraser, and we actually see a lot of moles, normal moles, bigger.
Sure. Yep.
And then finally, E, or evolving, it means changing, especially rapidly changing. So again, anything, you know, new, itching, bleeding, changing, growing, you know, those are all things to look out for.
As you know, when should a person, if they notice something, obviously,
Yep.
when should they start going? When should they contact their physician or the dermatologist? What's your recommendation? Should they observe it for a month, or do you recommend no, call and have it double checked right away just to make sure? What is a typical recommendation?
Yeah, well, I mean, there is no typical recommendation, but you know, I think if, I mean, obviously people get spots all the time, bug bites, pimples,
Sure.
you know, things heal relatively. You know, there's a lot of things that will heal on their own, but you know, if something has not healed in, say, a month, you know, I think then that's a reasonable thing. You know, or if something just looks very alarming, then by all means seek attention quickly.
Now, is your recommendations for skin types are differ, or no matter what your skin type is?
Yeah. So, I mean, skin cancer can occur in all skin types.
Okay.
It can. That being said, fairer skin types are definitely at higher risk.
Okay.
So redheads, blondes, fair skin, light eyes, those skin types definitely tend to develop skin cancer much more regularly, basal cell squamous cell and melanoma, but for certain, all skin cancer can occur in any skin type.
No, I think you hit on this a little bit for people to observe any different. Is there a specific way to self-examine the skin? I mean, obviously you look at it,
Right.
but is there a way to tell the different borders and mark or something that doesn't look right? Should somebody mark it and reserve it for a couple of days, like I said, or
Yeah.
Is there a way to do self-examination, for example?
I mean, if there is a mole or something that a patient is concerned about, I often tell them take a picture of it, and
Perfect.
every month take a look at your whole body.
Okay.
Take a look at your whole body with the help of mirrors, and even with the help of a loved one. Have your spouse or a loved one kind of help you take a look at areas that you can't see so well.
Sure.
But if there is a spot that you're not sure about, take a picture of it and follow it closely. But by all means, get it checked out by your primary care doctor or by a dermatologist if you have any concern whatsoever.
I mean, is it recommended? I'm not sure what the policies now are. Do PCPs or general practitioners at annuals take a look over the skin? I mean,
Oh yeah, absolutely.
Okay.
We are constantly getting referrals from primary care doctors that saw a spot and they're concerned about it, so they send them right over, and usually it's something significant.
Excellent, excellent. Dr. Alberta, there's always as a pharmacist, I'm sure as a physician, you always get questions about, do I have to worry about with certain medication classes that people may take? Can you hit on that just a little bit, just for our audience to understand that there's certain drugs or medications that an individual may take, which make their skin more susceptible to sun? It makes them burn a little faster?
Oh, absolutely. So, patients are on so many different medications.
Sure.
Blood pressure medicines, thiazide diuretics, especially hydrochlorothiazide, that can cause a lot of sun sensitivity and different, what we call photosensitized rashes.
Perfect.
So that's a big one,
Okay.
as well as other blood pressure medicine classes as well. NSAIDs, things like ibuprofen, and people don't realize it. They take it sometimes daily, and
Sure.
they don't realize that may make them more sun sensitive.
Okay.
A lot of medications that we prescribe as dermatologists can make them more sun sensitive too. Things like Accutane, antibiotics for acne, especially doxycycline is one of the big ones, or even sulfa medications,
Sure.
especially Bactrim. But even our topicals, like topical retin-As, or topical retinoids, they can make patients very sun sensitive as well.
So how does your recommendation for those patients in regards to sunscreen change, or does it?
Oh, it does. I mean, I tell patients just to be very cautious, and even more so, keep reapplying your sunscreen, wear hats, wear sunglasses, and especially be careful in higher altitudes, because even UV is even stronger. So if people are going on a hiking trip,
Sure.
or
Skiing?
skiing, or that definitely changes things too.
Okay, excellent, excellent. Is there anything else, Dr. Alberta, that you would like to re-mention to our audience and re-emphasize, just to make sure that we get our point across, especially in the summer days that we, ahead of us?
I definitely want you to have fun in the sun.
Okay.
But just be careful, and be careful. Seek the shade. Wear your sunscreen. Keep reapplying it. Wear hats and sunglasses. But it is a good thing to enjoy the summer too.
Thank you so much for being here. We appreciate it. You shared a lot of good information with us.
Thank you.
Dr. Alberta, thank you again for taking the time to join us on the show and sharing your expertise. You have provided us some very useful information, as I said, on how to enjoy the sun while staying safe. Thank you all for tuning in to A Healthier You. I'm Saad Dino, co-owner of Acton Pharmacy and West Concord Pharmacy, and look forward to seeing you in the community. Stay well.